Hi, my name is Shelby Custer, and this is a video of the lungs for our adult health class at Aspen University. I made a diagram of the lungs. So we're going to talk about inhalation, exhalation, injuries, lung capacity, and asthma. First, I want to talk about the anatomy just briefly because we all should know. So first you have your nose and your mouth. That's where the air comes into the body. It's where it enters. So deep breath, it's going to come in. It's going to meet at the back of the throat, go down the trachea, which is our throat here. And then you have your bronchioles, which are the big main stem or bronchi, big main stem bronchi. And then they branch out into bronchioles, which meet at the alveoli inside the lung. So then we have our diaphragm, which is the big muscle right here above all of our organs in our stomach. And that is one of the mechanical functions of breathing. And it allows the lungs to expand. So we're going to talk about inhalation first. So when we take a deep breath, you can feel the diaphragm pulling down. And I'm going to use my diagram here. This being the diaphragm. So as you can see, when I pull down, those lungs expand. So when the diaphragm pulls down, it's creating a negative pressure inside the chest cavity, which allows those lungs to expand. And the air meets at the alveoli, gases exchange, oxygen replaces the CO2, and as we exhale, positive pressure is reintroduced into the chest cavity and allows the lungs to collapse in a good way. And all the CO2 is expelled out of the nose and mouth here and into the air around us where it's exchanged elsewhere and turned into oxygen so that we can keep breathing. So that's the main function of the lungs and how the diaphragm aids in that. Of course, there's the muscles around the ribs that expand and help us breathe, but normally it's just the diaphragm. So one thing that we can talk about is the differences in lung capacity of different people. And there's a lot of things that can affect lung capacity. One of them being muscle weakness. So like I said, the diaphragm is a muscle. It contracts and then flattens to create that space. So if your diaphragm's very weak, or if you have some sort of disorder that weakens your muscles, electrolyte imbalances affect muscle contraction, all of these different things, and there's a lot to get into, can affect lung capacity. So if your diaphragm's weak and you can't quite get that deep breath, so on the diagram, barely filling, sometimes it'll only fill one, but barely filling. But if you have a strong diaphragm that pulls down, our muscles are expanded all the way. So muscle strength. Another thing could be trauma or injury. We'll get into that. Disease processes, talked a little bit about it, one being asthma. And then the other biggest thing is obesity. So when someone is obese or has a high BMI, there could be a lot of fat surrounding the diaphragm, which the diaphragm may be strong, but there's no room to expand. So a lot of fatty tissue around the diaphragm can affect lung capacity. And then the other biggest one is smoking. So that has a lot to do with how the gas is exchanged because of the chemicals that are in smoke. But when that happens, your lungs don't really want to expand. So your lung capacity over time weakens or gets smaller. So those are the things that affect lung capacity. The next I want to talk about is asthma. So asthma is a disease of the bronchi and bronchioles that causes overconstriction. So when someone doesn't have asthma, our bronchi still expand and constrict depending on our oxygen demand. And so pollen, dust, allergens, some smells, some of those things that our lungs don't want in, they'll close up a little to let as little in as possible. With asthma, they just keep going and going and going until there's no space for air to pass through. That's why you hear the wheezing with asthma patients because you're trying to force air into nothing, basically. So we want our rescue inhaler handy to just relax the bronchi and open them back up. So asthma is a really deadly disease. A lot of people die from asthma all the time, especially kids who don't know they have it because can't go long without oxygen. Another thing I want to talk about is puncture wounds. And there's a lot of different possibilities and things to talk about, especially me specializing in trauma. There's a lot of different things to look for. But what I mainly want to go over is two different things that can happen. One, it can fill that space in around the lungs with air, and it can fill it with fluid. So when our chest cavity is a closed space. We don't like air or fluid getting in. We like what we have in there. We don't like anything interfering with that. So let's say someone's stabbed right here in the chest. So they get stabbed, knife comes out, and now there's air rushing into that chest cavity. As we breathe in, there's not a lot of space for any air to come in, but as we exhale, our lungs shrink up, and now there's all that space for air to come in. It's called a sucking chest wound, and it literally sucks all the air in, and now that space is filled with air, and all the blood and stuff covering the hole, there's no way for it to escape, really. So as we breathe in again, this space where we were stabbed, that lung's not going to be able to expand. Another one could be fluid. Let's say we were in a car accident from the side and we got hit right into our chest here. And there's no injury on the outside, but we have a broken rib. And the rib punctures into that pleural space. And so inside the pleural space, there's serosa, which is a fluid that helps reduce friction. But we don't like any air or anything else in that space. So if we're hit and it is punctured, it's going to try to fill up. So kind of same thing where it's just going to be trapped. So lungs are collapsed, right? We just exhaled, but as we try to breathe in, all that space is now filled with fluid and your lung can't expand. Luckily, we have two lungs. So for a very, very short period of time, we can compensate for that. But of course, it does need emergency medical attention to fix the problem so that it doesn't crush our lung completely. A lot of the time you'll see jugular deviation where all that pressure building up is going to push your trachea to the side and tracheal deviation and jugular distension. So backup of fluid because our lungs aren't exchanging with the heart all the blood and the oxygen. So that is the lungs in a flash. Thank you so much for watching.